Welcome back to Telecare's online training. For today's session, we will be continuing our unit on mental health. So let's get started. Picking back up in Unit 9. So to begin, what is schizophrenia? Schizophrenia is a serious mental illness that affects roughly 300,000 Canadians. Although it affects men and women with equal frequency, schizophrenia most often appears in men in their late teens or early 20s, while it appears in women in their late 20s or early 30s. Finding the causes for schizophrenia proves to be difficult as the cause and course of the illness is unique for each person. Interfering with a person's ability to think clearly, manage emotions, make decisions, and relate to others, schizophrenia impairs a person's ability to function to their potential when it is not treated. Unfortunately, no single, simple course of schizophrenia treatment exists. Research has linked schizophrenia to a multitude of possible causes, including aspects of brain chemistry and structure, as well as environmental causes. So, as a noun, it means a psychotic disorder characterized by loss of contact with the environment, by noticeable deterioration in the level of functioning in everyday life, and by disintegration of personality expressed as a disorder of feeling, thought, perception, and behavior, also called dementia praecox. The onset of schizophrenia in most people is a gradual deterioration that occurs in early adulthood, usually in a person's early 20s. Loved ones and friends may spot early warning signs long before the primary symptoms of schizophrenia occur. During this initial pre-onset phase, a person may seem without goals in their life, becoming increasingly eccentric and unmotivated. They may isolate themselves and remove themselves from family, situation, and friends. They may stop engaging in other activities that they used to enjoy, such as hobbies or volunteering. Warning signs that may indicate someone is heading toward an episode of schizophrenia or psychosis include social isolation and withdrawal, irrational, bizarre, or odd statements or beliefs, increased paranoia or questioning others' motivations, becoming more emotionless, hostility or suspiciousness, lack of motivation, increasing reliance on drugs or alcohol in an attempt to self-medicate, speaking in a strange manner that seems unlike themselves, inappropriate laughter, insomnia or oversleeping, and deterioration in one's personal appearance and hygiene. While there is no guarantee that one or more of these symptoms will lead to schizophrenia, a number of them occurring together should be cause for concern, especially if it appears that the individual is getting worse over time. This is the ideal time to act to help the person, regardless of outcome. What are the symptoms? So the symptoms of schizophrenia fall into two broad categories. Positive symptoms, sometimes called psychotic symptoms, refer to an increase in the presence of behaviors and experiences of people with schizophrenia than without schizophrenia, such as hallucinations and delusions. Negative symptoms refer to traits that are absent or reduced in people with schizophrenia, such as social withdrawal or lack of motivation. Generally, positive symptoms are things that are added, while negative symptoms are things that are taken away in feelings, behaviors, and personality. Some examples of positive symptoms are hallucinations, which is when someone experiences something that does not actually exist. Hallucinations can occur within any of the five senses, including sound, sight, touch, taste, or smell. Delusions are strongly held irrational, fixed, and false beliefs that are not consistent with the person's culture and have no basis in fact. Disorganized thinking, making loose associations, drawing conclusions which are not based on reality, making it difficult to communicate clearly. Disorganized mood, finding it hard to express feelings, having inappropriate feelings, intense bursts of emotion, or feeling empty of all emotion. Disorganized behavior, unable to complete everyday tasks such as bathing, dressing appropriately, or preparing simple meals. Changes in sensitivity, more sensitive and aware of others or withdrawn and paying no attention. and agitation, an unpleasant state of increased tension and irritability. Some negative symptoms include a lack of drive or initiative, spending a lot of time in bed with no motivation to do anything, problems finishing tasks or making long term plans, social withdrawal or depression, giving the impression that the affected person prefers to be alone and does not want to see other people, apathy, experiencing feelings of emptiness and inability to follow through on plans, lack of emotional response, lacking normal signs of emotion, not feeling either happy or sad, for example, reduced facial expressions, slowing of physical activity levels, or at times there's overactivity, loss of interest in the feelings and lives of others, loss of concern for their own personal condition and appearance. Earlier treatment and shorter duration of untreated psychosis is associated with better treatment response, less likelihood of relapse, and better clinical outcome. That quote is by Sandra De Silva, PhD, Department of Psychology and Psychiatry at UCLA. Treatment for schizophrenia. People with schizophrenia may be treated as outpatients or may require hospitalization. Treatment usually consists of medications coupled with psychosocial interventions. In some cases, a psychiatrist will prescribe medications while a therapist will monitor the individual's progress and can also observe for response to medication treatments. The therapist and prescribing psychiatrist will be in contact to discuss thoughts on how to best treat and support their mutual patients. Medication. Antipsychotic medications are the main class of drug used for schizophrenia. A common misconception about such drugs is that they act as a kind of mind control or chemical straitjacket. Antipsychotic drugs used at the appropriate dosage do not knock out people or remove their free will. They relieve the symptoms of psychosis and may help to prevent relapse. Additional medications may be prescribed to help manage side effects of antipsychotics or to treat particular symptoms such as depression, anxiety, or sleep difficulties. Some common antipsychotic medications include Haldol, Torazine, Ciprexa, Seroquel, Risperdal, and Abilify. Psychosocial treatments. Psychosocial treatments, including certain forms of psychotherapy, often referred to as talk therapy, and social and vocational training, are helpful in providing support, education, and guidance to people with mental illness and their families. Studies indicate that psychosocial treatments for mental illnesses can help individuals decrease the negative effects of their illness and increase their functioning, leading to fewer hospitalizations and less difficulties at home, school, and work. A licensed psychiatrist, who is a doctor who can prescribe psychotropic medications, a psychologist, a social worker, psychiatric nurse, or therapist typically provide these psychosocial therapies. These types of therapies include cognitive behavioral therapy, otherwise referred to as CBT, which is a treatment that focuses on the relationship between an individual's thoughts, feelings, and behaviors. A CBT therapist will try to explore the links between the thoughts and emotions that occur prior to disruptive behaviors in people with mental illness. Psychoeducation involves teaching people about their illness and how they are treated. This allows people and their families to recognize the signs of relapse in order to get necessary treatment before mental illness worsens or occurs again. Family support, education, and counseling, often provided through self-help and support groups, which are not generally led by a professional therapist. They help people living with schizophrenia and their families in area of education, advocating, and support. They offer friendship, understanding, and hope, sharing referrals and community resources. Social skills and life skills training. Schizophrenia develops generally in young people during the years when they would normally develop the skills needed for independent living. A variety of programs such as case management, academic and employment counseling, and housing programs are often used to help people develop these skills. Recovery. It is difficult to predict how well a person will recover after the onset of schizophrenia. Some people will only have one episode of psychosis symptoms. Some people will have recurring episodes. Many of these people can live independently with limited supports between episodes. And some people will require medication and ongoing support for the rest of their lives. Socialization and bias. Social difficulties are one of the hallmarks of schizophrenia. Negative symptoms can make picking up on social cues challenging, which are further complicated by competing stimuli from positive symptoms, can make conversations more difficult, particularly with people who don't know much about schizophrenia and the mental health recovery process. In addition, some people feel isolated because they are aware that others do not share their hallucinations or delusions. There's bias around mental illness, and as many as 96% of individuals living with schizophrenia experience discrimination and mental disorder stigma. Other people can expect negative things from them or nothing at all because of their illness. Prejudice can come from outside and inside of a person. A person might have negative experience with potential employers rejecting their job applications, or they might be hindered by anxiety about these possible transactions. Social skills training can be useful for finding appropriate ways to interpret and respond to social cues. This training can occur formally in classes or therapy, or informally within peer groups or a clubhouse setting. And it is important to step in mental health recovery. Volunteer opportunities or any other venue where an individual already has something in common with the other participants can offer a less risky atmosphere. Employment. Research suggests that as many as 70% of people living with schizophrenia would like to be engaged in competitive employment, but fewer than 15% are actually employed. People living with schizophrenia can find a sense of accomplishment and independence from working. In addition, it improves social skills rather than isolating an individual in need of mental health help, which tends to exacerbate negative symptoms. Fast facts. Schizophrenia is a common disorder affecting around 1% of people worldwide. Currently, the cause is unknown. It is believed that genetics are involved and research is ongoing. Schizophrenia is a physical disorder affecting the brain and therefore can affect perception and behavior. People with schizophrenia are more likely to harm themselves. Schizophrenia can be a treatable disorder. The majority of people will experience either considerable reduction in symptoms after treatment or no further symptoms. Schizophrenia is not a multiple personality disorder, and schizophrenia is not caused by bad parenting. People with schizophrenia are people with talent, potential, and capability. All right, and that completes part 4. Anxiety disorder. As a noun, it is an anxiety disorder is marked by chronic excessive anxiety and worry that is difficult to control, causes distress or impairment in daily functioning, and is accompanied by 3 or more associated symptoms such as restlessness, irritability, poor concentration, and sleep disturbances. Anxiety attacks and anxiety disorders. It is normal to feel anxious when facing a challenging situation, such as a job interview, a tough exam, or a blind date. But if your worries and fears seem overwhelming and interfere with your daily life, you may be suffering from an anxiety disorder. There are many types of anxiety disorders and many effective treatments and self help strategies. Once you understand your anxiety disorder, there are steps that you can take to reduce your symptoms and regain control of your life. Anxiety is the body's natural response to anger, to danger, an automatic alarm that goes off when you feel threatened, under pressure, or are facing a stressful situation. In moderation, anxiety isn't necessarily a bad thing. In fact, anxiety can help you stay alert and focused, spur you to action, and motivate you to solve problems. But when anxiety is constant or overwhelming, when it interferes with your relationships and activities, it stops being functional. That's when you've crossed the line from normal, productive anxiety into the territory of anxiety disorder. Types of anxiety disorders. There are 6 major types of anxiety disorders, each with their own distinct symptom profile, such as generalized anxiety disorder, obsessive compulsive disorder, panic disorder, phobia, post traumatic stress disorder, and social anxiety disorder. Generalized anxiety disorder. People with this disorder may more often than not feel anxious or worried. Anxiety related to GAD often shows up as physical symptoms like insomnia, stomach upset, restlessness, and fatigue. Panic disorder. It's characterized by repeated, unexpected panic attacks, as well as fear of experiencing another episode. Panic disorder may also be accompanied by agoraphobia, which is a fear of being in places where escape or help would be difficult in the event of a panic attack. If a person has agoraphobia, they are more likely to avoid public places such as shopping malls or confined spaces such as airplanes. Phobia. A phobia is an unrealistic or exaggerated fear of a specific object, activity, or situation that in reality presents little to no danger. Common phobias include fear of animals, such as snakes and spiders, fear of flying, and fear of heights. In the case of severe phobia, a person might go to extreme lengths to avoid the things they fear. Unfortunately, avoidance only strengthens the phobia. Social anxiety disorder. If a person has a debilitating fear of being seen negatively by others and humiliated in public, they may have social anxiety disorder, also known as social phobia. Social anxiety disorder can be thought of as extreme shyness. In severe cases, social situations are avoided altogether. Performance anxiety, better known as stage fright, is the most common type of social phobia. And post-traumatic stress disorder. PTSD is an extreme anxiety disorder that can occur in the aftermath of a traumatic or life-threatening event. PTSD can be thought of as a panic attack that rarely, if ever, lets up. Symptoms of PTSD include flashbacks or nightmares, hypervigilance, startling easy, withdrawing from others, and avoiding situations that reminds a person of the past event. OCD, or obsessive compulsive disorder. It is normal on occasion to go back and double check that you have locked doors or turned off the stove. However, if you have OCD, obsessive thoughts and compulsive behaviors become so excessive that they interfere with your daily life. OCD is characterized by uncontrollable, unwanted thoughts and repetitive, ritualized behaviors that one feels compelled to perform, even though they may recognize that the repetitive behaviors are irrational. Some signs and symptoms of anxiety disorders. Because anxiety disorders are a group of related conditions, rather than a single disorder, they can look very different from person to person. One individual may suffer from intense anxiety attacks that strike without warning, while another gets panicky at the thought of them going at a party. Someone else may struggle with a disabling fear of driving or uncontrollable, intrusive thoughts. Yet another may live in constant state of tension, worrying about anything and everything. Despite their different forms, all anxiety disorders share one major symptom: a persistent or severe worry in situations where most people wouldn't feel threatened. So, some emotional symptoms of anxiety are anticipating the worst, feelings of apprehension or dread, irrational, excessive fear and worry, trouble concentrating, feeling tense and jumpy, feeling like your mind has gone blank, watchful for the signs of danger, and restlessness. Physical symptoms of anxiety. These include pounding heart, frequent urination or diarrhea, dizziness, sweating, upset stomach, shortness of breath, tremors and twitches, fatigue, insomnia, muscle tension, and headaches. Many people with anxiety disorders also suffer from depression at some point. Anxiety and depression are believed to stem from the same biological vulnerability, which may explain why they so often go hand in hand, since depression makes anxiety worse and vice versa. It may be important to seek treatment for both conditions. When to seek professional help for anxiety disorders. Not everyone who worries a lot has an anxiety disorder. A person may be anxious because of an overly demanding schedule, a lack of exercise or sleep, pressure at home or work, or even from too much coffee. Some self help strategies can be very effective at coping with some types of and causes of anxiety. However, if your worries, fears, or anxiety attacks have become so great that they're causing extreme distress or disrupting your daily routine, it is important to seek professional help. If you are experiencing a lot of physical anxiety symptoms, consider getting a medical checkup. Your doctor can check to make sure your anxiety is not caused by medical conditions such as thyroid problems, hypoglycemia, or asthma. Certain drugs and supplements can cause anxiety, and your doctor will want to know about any prescriptions, over the counter medications, herbal remedies, or recreational drugs that you're taking. If your physician rules out a medical cause, the next step is to consult with a therapist who has experience treating anxiety attacks and anxiety disorders. The therapist should work with you to determine the cause and type of your anxiety disorder and devise a course of treatment. Some treatment options for anxiety disorders. Anxiety disorders respond very well to treatment and often in a relatively short amount of time. The specific treatment approach depends on the type of anxiety disorder and its severity. But in general, most anxiety disorders are treated with behavioral therapy, medication, or some combination of the two. Sometimes complementary or alternative treatments may also be helpful. So, behavioral therapy for anxiety disorders could include cognitive behavioral therapy or CBT, and exposure therapy, meaning they focus on the behavior rather than the underlying psychological conflicts or issues from the past. Behavioral therapy for anxiety usually takes between 5 and 20 sessions. Cognitive behavioral therapy, as covered previously, focuses on thoughts or cognitions in addition to behaviors. In anxiety disorder treatment, CBT helps to identify and challenge the negative thinking patterns and irrational beliefs that fuel one's anxiety. Exposure therapy for anxiety disorder treatment encourages you to confront your fears in a safe, controlled environment. Through repeated exposures to the feared subject or situation, either in one's imagination or reality, you can gain a greater sense of control. As you face your fear without being harmed, anxiety will gradually diminish. And then there's medication for anxiety disorders. A variety of medications, including benzodiazepines and antidepressants, are used in the treatment of anxiety disorders, but medication is most effective when combined with therapy and self help strategies. Medication may sometimes be used in the short term to relieve severe anxiety symptoms so that other forms of therapy can be pursued. And some self help for anxiety attacks and anxiety disorders. Keeping in mind that self help is not a replacement for physician care or an indication that anxiety can be controlled without help. There are some suggestions of things that can help mitigate symptoms of mild anxiety or ideas that you can explore with callers. Some of these suggestions are to challenge negative thoughts. You can encourage a caller to write down their worries. Keep a pad and pencil on you using your laptop, smartphone, or tablet. When experiencing anxiety, write down your worries. Writing is harder work than just thinking about them, so your negative thoughts are likely to disappear sooner. Create an anxiety worry period. Choose 1 or 2 or 10-minute worry periods each day, each time that you can devote to anxiety. During your worry period, focus only on negative or anxious thoughts without trying to correct them. The rest of the day is to be designated free from anxiety. When anxious thoughts come to your mind during the day, write them down and postpone them to your worry period. Accept uncertainty. Unfortunately, worrying about all the things that could go wrong doesn't make life any more predictable. It only keeps you from enjoying the good things happening in the present. Learn to accept uncertainty and not require immediate solutions to life's problems. 2, take care of yourself. A way to do this is practice relaxation techniques. When practicing regularly, relaxation techniques such as mindful meditation, progressive muscle relaxation, and deep breathing can help reduce anxiety symptoms and increase feelings of relaxation and emotional well-being. Adopt healthy eating habits. Start the day right with breakfast and continue with frequent small meals throughout the day. Going too long without eating can lead to low blood sugar, which can make you feel more anxious. Reduce alcohol and nicotine. They lead to more anxiety, not less. Exercise regularly. Exercise is a natural stress buster and anxiety reliever. To achieve the maximum benefit, aim for at least 30 minutes of aerobic exercise on most days. And get enough sleep. A lack of sleep can exacerbate anxious thoughts and feelings, so try to get 7 to 9 hours of quality sleep a night. Panic attacks. What is a panic attack? So, a panic attack is a sudden episode of intense fear that triggers several physical reactions when there is no apparent danger or cause. Panic attacks can be very frightening. When a panic attack occurs, one might think that they are losing control, having a heart attack, or dying. Many people have just one or two panic attacks in their lifetimes when the problem goes away, perhaps when a stressful situation ends. But if you have had recurrent, unexpected panic attacks and spent long periods in constant fear of another attack, you may have a condition called a panic disorder. Panic attacks were once dismissed as nerves or stress, but they're now recognized as a real medical condition. Although panic attacks can significantly affect one's quality of life, treatment can be very effective. So the medical definition of a panic attack is an episode of intense fear or apprehension that is of sudden onset and may occur for no apparent reason, or as a reaction to an identifiable triggering stimulus, such as a stressful event. One that is accompanied by usually 4 or more body or cognitive symptoms, such as heart palpitations, dizziness, shortness of breath, or feelings of unreality, and typically peaks within 10 minutes of onset. Some research suggests that your body's natural fight or flight response to danger is involved in panic attacks. For example, if a grizzly bear came after you, your body would react instinctively. Your heart rate and breathing would speed up as your body prepared itself for a life-threatening situation. Many of the same reactions occur in a panic attack, but it is not known why a panic attack occurs when there is no danger present. It is not known what causes panic attacks or a panic disorder, but these factors may play a role. Genetics, major stress, temperament that is more susceptible to stress, and certain changes in the way parts of your brain functions. So before we turn to the description of a panic attack, there are some very important rules to remember as a telephone volunteer. Refrain from giving advice as to how to self-treat a panic attack. If a panic attack continues while the caller is still speaking with you, suggest calling 911. Remain calm while speaking with someone experiencing a panic attack. Sometimes all the caller needs is a calm, reassuring voice to help alleviate the attack. However, if it continues, suggest calling 911. Never assume the caller is experiencing a panic attack or advise the use of old-style remedies such as breathing into a paper bag. They could be experiencing a heart attack or another medical condition. While a person can have a history of panic attacks, there's no way of telling if this current attack is a panic attack or caused by some other reason. Panic attacks can also be brought on by medical conditions and other physical causes. It's important to see a doctor to rule out the following possibilities. So symptoms. Panic attacks typically begin suddenly without warning. They can strike at almost any time, like when you're driving the car, at the mall, even when you're asleep, or in the middle of a business meeting. Panic attacks have many variations, but symptoms usually peak within 10 minutes. One might feel fatigued and worn out after a panic attack subsides. Some symptoms include trembling, abdominal cramping, chest pain, tightness in one's throat, chills or hot flashes, shortness of breath, hyperventilation, dizziness, fear of loss of control or death, sweating, sense of impending doom or danger, nausea, faintness, trouble swallowing, rapid heart rate, and headache. The symptoms can be so overwhelming that the person may believe that they are going to die. In fact, it is not unusual for individuals experiencing panic attacks to end up at the hospital emergency department numerous times, convinced that they are in fact having a heart attack. One of the worst things about panic attacks is the intense fear that you'll have another one. You may fear having a panic attack so much that you avoid situations where they may occur. You may even feel able to leave your house, such as agoraphobia, because no place feels safe. The panic cycle. Anxiety, causing a panic attack, which causes the fear of another one, which causes more anxiety, which causes another attack, which causes more fear. Risk factors. Symptoms of panic disorder often start in late teens or early adulthood and affect more women than men. Factors which may increase the risk of developing panic attacks or panic disorders include family history of panic attacks or panic disorder, significant stress, death or serious illness, major changes in your life, such as the addition of a family member, history of childhood abuse, experiencing a traumatic event, and complications. Left untreated, panic attacks and panic disorder can result in severe complications that affect almost every area of life. You may be so afraid of having more panic attacks that you live in a constant state of fear, ruining your quality of life. Complications that panic attacks may cause or be linked to include development of specific phobias, such as the fear of driving or leaving one's home, avoidance of social situations, problem at school or work, depression, increased risk of suicide or suicidal thoughts, alcohol or substance abuse, or financial problems. When to seek professional help. If you have panic attack symptoms, seek medical help as soon as possible. Panic attacks are hard to manage on one's own, and they may get worse without treatment. Because panic attack symptoms can also resemble other serious health conditions, it's important to get evaluated by your healthcare provider if you aren't sure what's causing your symptoms. Diagnosis. To help pinpoint a diagnosis for your symptoms, you'll likely have several exams and tests. Your doctor or other healthcare provider must determine if you have panic attacks, panic disorder, or another condition such as heart or thyroid problems, which resemble panic symptoms. You may have a complete physical exam, blood tests to check your thyroid and other possible conditions, and tests on your heart, such as an electrocardiogram, ECG or EKG, to help determine how well it's functioning. An evaluation by your doctor or mental health provider to talk about your symptoms, stressful situations, fears or concerns, relationship problems, and other issues affecting your life. You may fill out psychological self-assessments and questionnaires. You may also be asked about alcohol and other substance use. Diagnostic criteria for panic disorders. Not everyone who has panic attacks has a panic disorder. To be diagnosed with panic disorder, you must meet these criteria from the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. This includes frequent unexpected panic attacks. At least one of your attacks has been followed by 1 month or more of ongoing worry about having another attack, ongoing fear of the consequences of an attack, such as losing control, having a heart attack, or going crazy, or significantly changing your behavior, such as avoiding situations that you think may trigger a panic attack. Your panic attacks aren't caused by substance abuse, a medical condition, or another mental health condition, such as a social phobia or OCD. For some people, panic disorder may include agoraphobia, avoiding places or situations that cause someone to get anxiety because of fear of not being able to escape or to get help if one has a panic attack. So if you have panic attacks but not a diagnosed panic disorder, you can still benefit from treatment. If panic attacks aren't treatment, they can get worse and develop into panic disorder or phobias over time. Treatment. The goal of treatment is to eliminate panic attack symptoms. With effective treatment, most people are eventually able to resume everyday activities. The main treatment options for panic attacks are psychotherapy and medication. Both are effective. Your doctor will likely recommend one or both types of treatment, depending on your preference, your history, the severity of your panic disorder, and whether there are specialized therapists in your area. Psychotherapy, also called talk or behavior therapy, is considered an effective first choice treatment for panic attacks and panic disorder. Psychotherapy can help you understand panic attacks and panic disorder and learn how to cope with them. Cognitive behavioral therapy, CBT, can help you learn through your own experience that panic symptoms are not dangerous. During therapy sessions, your therapist will help you gradually recreate the symptoms of a panic attack in a safe and supportive setting. Once the physical sensation of panic no longer seems threatening, the attacks begin to resolve. Successful treatment can also help you overcome fears or situations that you've been avoiding because of panic attacks. Your therapist may suggest weekly meetings where you begin psychotherapy. You may start to see improvements in panic attack symptoms within several weeks, and often symptoms decrease significantly or go away within months. As your symptoms improve, you and your therapist will develop a plan to taper off therapy. You may agree to schedule occasional maintenance visits to help ensure that your panic attacks remain under control. Medications. Medications can help reduce symptoms associated with panic attacks as well as depression if that's an issue for you. Several types of medication have been shown to be effective in managing the symptoms of panic attacks. Past facts. So, anxiety disorders are among the most common type of mental health problems, affecting 1 out of every 10 Canadians. Panic disorders affect approximately 2 million Canadians. Two-thirds of people seeking treatment are women. Panic attacks may be totally unpredictable, last 10 to 30 minutes, and are unrelated to any specific trigger. Due to the ongoing stigma surrounding mental illness, people with panic disorders are often called overreacting or hysterical. Coupled with their own feelings of embarrassment and guilt, these individuals often do not seek help for a condition that is treatable. Even though people who are having a panic attack know that their reaction is disproportionate or even unrelated to a situation, they cannot stop the terror that paralyzes them. Review the following interactive slides to learn more. And here are some resources for further reading. And that completes unit, I should say 9 on mental health. So if you're following along on a compatible device, you can continue to the evaluation section. Otherwise, that is it for today's session, and we'll see you next time for Unit 10.